Hello, everybody. Welcome back to the channel, Dr. Jonathan Pearlman. Today is December 31st, New Year's Eve, 2024. It's been a very wild ride of a year, and I'm going to do a reflection video of what I've learned in 2024 and what does that mean in terms of moving forward, not just for me, but for if I could give and share my experiences and somehow help you out there in any capacity, then that is what I want to do. And first, I'll start off by saying that learning from mistakes is important in life, and only through trial and error can you become better. But in the famous words of Tom Brady, and if it wasn't Tom Brady, then maybe it was Vince Lombardi before him, and many other coaches that like this particular quote in sports, it's practice doesn't make perfect. Perfect practice makes perfect. Now, why is that so important? Well, it's because if you practiced all the time, it doesn't necessarily mean you're going to get it down pat. That's showing up every day, doing the same thing, sometimes expecting a different result. That is the definition of insanity. But if you learn from any mistakes or lack of progress being made, you can then adapt and make, whether they be small, nuanced changes within your system, to become much better at whatever that is. Most people think of it as economics and profit, money, but other people might think of it as, physical fitness, function. Other people may be, more efficient with time. They might be doing it better with their diet. I'm not going to keep going down all these different components. Hopefully you understand what I'm saying, because yes, what I have learned is that perfect practice makes perfect. Now, what does that mean? I'll give you a quick chiropractic example, and I do mean quick, and then we move on from there, because anyone watching this video always deserves to know the truth if they tune in, especially towards me from like a clinical practice side. And that is, early on in my career as a chiropractor, I did things specifically where it was like a systematic Gonstead approach. Now, I still use Gonstead as my systematic analysis approach, sort of steps one, step two, the way I study x-ray, the way I look at like a fascial distortion, the way I think about disc when it comes to someone who's been injured. And what I mean by the example I'll give is, it used to be you'd lay them on their side and do a very specific adjustment. And what I found was my patients weren't getting stable, meaning even if they started feeling better fast, which is usually the case with good chiropractors, pat myself on the back there, people will feel better fast, but they don't stay better. They don't get stable within like week 2, week 3 of like a really bad lower back injury or really bad neck injury. They really don't do well longer term. And I started seeing this plateau, and I talked to my patients about, and I've discussed with other doctors about the principle of diminishing return. But once I started doing Y-axis traction maneuvers, where I was actually targeting the lower back without any components of rotation in the adjustment, and still able to get the disc to gap and reset, and getting those joints to sort of cavitate or tribonucleation. That is the words that we use scientifically for the big crunch that happens, but the desirable crunch, not those loud snap, 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 right? I started seeing people recover much faster, get stable, and really progress in their care. See, that is putting, me going to work every day, clinical practice, into a real world sort of adapting, and only perfect practice makes perfect for the patients that were candidates for that type of maneuver, doing much better. Do I care about what other Gonstead doctors care about me out there? Absolutely not. It means nothing to me. Do I care about the way I'm perceived by other chiropractors, not just Gonstead doctors? Maybe on some extent the answer would be yes, but that's like a very small amount, because what I do care about is how I'm perceived by my patients, and how my patients think of my care and value my care. And if I have put my hands on you in a chiropractic manner and you have felt a benefit and say, wow, I really appreciate what he's done, that's all I care about. And seeing you walking better, feeling better, telling other people, hey, this guy really helped me. He knows what he's talking about. I went to so-and-so chiropractor and they didn't maybe deliver because of kind of what we talked about earlier. That's all I care about when it comes to this clinic and, the reputation of my Paramount Chiropractic and Wellness, and, my name as a chiropractor. So that's the chiropractic example. And that's what I've learned in 2024 in terms of perfect practice makes perfect, being honest with yourself, being honest with others, and really having like a rational mindset towards progression and like improvement is really, the key. The next thing I want to talk about is some self-care aspects that I never really put fully into practice before, and that is supplementation as like a mainstay. I take almost every day, so I do not do this every day, but almost every day, I take vitamin D3 in those little gel capsules. So I do about 10,000 IU every other day to every day. It's like if I had to give it a 5 day a week thing, it's between 4 and 5 days a week. I take a magnesium malate stack once a day, but that again is like probably 3 times a week. Malate for muscles, magnesium malate. Malate's been scientifically proven to reduce the amount of lactic acid built up. Remember, we all think of potentially the reason that we're sore is lactic acid. Some people now dispute that, or it's been disproven. You know what? I don't even care if it's been disproven because we know lactic acid is a thing. We know it does build up in the muscles. We do know it's some kind of factor in like skeletal muscle fatigue, and we know that malate will reduce the amount that happens. Thus, there's been some clinical trials of people having malate, whether it be from fruit or even in the magnesium doses, to have reduced muscle soreness. For me, clinically, what I've seen is the vitamin D fish oil. So I take fish oil just about every day as well. Omega-3 fish oil, this Ultimate Omega Nordic Naturals brand that I really like. No promotion, obviously. And so I would like those supplements. I like those 3 supplements. And then if I'm hurt, and of course this is not a doctor recommendation because I cannot recommend non-steroidal anti-inflammatories or anything, even if it is over the counter, it's not a recommendation. It's just personal experience that if I'm extra sore or I don't feel quite right or I feel a little too sluggish or the pain intensifies to a greater degree, I will take baby aspirin. I like baby aspirin because it is not ibuprofen at 500 milligram or 250 milligram. It is acetylsalicylic acid, which is an NSAID. It is a non-steroidal anti-inflammatory, and it is an anticoagulant, by the way, wink, wink. It is the sort of first-line preventative recommendation when people feel tightness in the chest or potentially even have blood thickening or high blood pressure type problem. Baby aspirin is a recommended, Mayo Clinic doctor recommended style intervention to use. I like maybe once to twice a week to have baby aspirin in the evening to reduce inflammation and make sure that I am anticoagulating if it be an effect, meaning until the day that I have my arteries scanned with what they call a CT angiogram of the head and neck or any other part of the body to actually show if there's occlusions in arteries, I can take that, what we call prophylactically, preventative, to be a little bit more mindful that it could help. And yes, your inflammation will reduce based on taking a couple of baby aspirin once in a while. And the reason I say that is because it's an anti-inflammatory. It's much easier on the stomach versus like COX-1 versus COX-2 inhibitor. These are physiologic things that happen in terms of stomach acidity and or the way your stomach or GI bleeding can occur and will occur if you take things like ibuprofen or even acetaminophen in like very large doses over time. So I prefer, me personally, if I was to have, say, 160 milligrams of baby aspirin that got absorbed and reduced inflammation and was an anticoagulant, I certainly like that a lot more than taking 1,000 to 2,000 milligrams of ibuprofen and having a big hole in my stomach and then having bigger problems later on. So that's all I'm going to say about those supplement choices and recommendations that I wish I was more diligent in years past. However, when it comes to conditions such as I had, I don't know if it would have made a big difference at all, because it brings me to sort of my last point for 2024. I have learned through personal experience, me as the patient, that there is something that we talk about in science. It's a biological sort of rule, and that is there is what we call limitations of matter. Meaning it doesn't matter how mindful you are. It doesn't matter how much cold plunging or hot sauna you do. It doesn't matter how much running or walking you do. It doesn't matter how good your diet is. If you have something that is blocking something, if your body anatomically has something in the way of proper function, whether your symptoms are pain, like mine was debilitating lower back pain, or whether your symptoms are, you know, constant headaches that just never go away, or stomach pain, or foot pain, or numbing, burning, and tingling that never goes away, and is just something you're dealing with, there's probably a limitation of matter somewhere. Something is occluded, something is not right. You need to get the advanced scan, and you need to get a surgical medical doctor consult. And the reason I say that is because that is the time and place for medical intervention in the sense of allopathic, traditional, going to the doctor. Maybe you have to take a pharmacological aid or a pill in the interim before or during or just slightly after your surgery, because what I'm getting at is you may need a surgical intervention. I did. It definitely is very close to saying that probably saved my life's, the functionality part of my life, the same way I give credit to my chiropractor years ago, Doug DQ for saving my life. My surgeon probably saved my life. He certainly saved my career in terms of my ability to bend and reach and work with patients. So we can't downplay it. Now, does that mean that it's like the fix, end all be all? No, of course not. Oftentimes it's lifestyle choices or something that happened in our environment, even if it was out of our control, that brought on this sort of devastating injury that leads to the limitation of matter. And once it's addressed, there's still environmental factors that need to be cleaned up even after said surgical repair. And that was a big part of what I learned this year. I learned about alternative other ways to reduce the sort of pain associated with scar tissue. I learned about ways that, diet is just so beyond important that every single time somebody, maybe downplays it or says, oh, it's too strict, it's not sustainable. What's not sustainable is living being sick. What's not sustainable is the amount of stress you're putting on your body, the amount of stress you're putting not just on your physical health, but also your family's emotional and physical health as well, because emotional trauma manifests itself physically, whether you like it or not. Take that to the bank, because it's true. And that doesn't mean it's psychosomatic. That doesn't mean it's psychological and in someone's head. It literally means that's how physiology works. We talked about in the beginning of the video, sympathetic or parasympathetic, or if I didn't, I'm bringing it up now. Fight or flight, sympathetic, in a state of constant, oh my God, what's going to happen to me? That is stress. Any little tissue deformity could end up becoming, what's the word I'm looking for? Magnified in terms of the damage that is already there, and pain will occur. Even if you looked at it from an internal side, if your kidneys are stressed, if your adrenal system is fatigued, there's a real thing called limbic system dysfunction. This is very like, wooey stuff. No, I've known people personally who had to be hospitalized and actually put in medical state type of, not a coma, but like they had to be controlled with drugs to be able to force for them to sleep, for their body to actually begin to repair, and then work with nutritionists and people that were experts in other areas of, not endocrinology, the adrenal system, we'll say for now, because I can't think of the word, and they were monitored, and then their kidney functions monitored and kept, on track until they were finally able to be, released with very strict dietary and sleeping and resting and workload guidelines, because they literally stressed themselves into sickness. These are real stories. I mean, you can go and look up multiple, stories if you start searching the internet. And that's all me just kind of saying, acknowledge that it's not like mental health we know mental health is an issue. We know mental health is real. But oftentimes what people downplay is if like you're not someone who's been diagnosed in your family, who's walking around on, God forbid, who knows how many medications for your anxiety and depression or things of that nature, then what happens is people just think that it's like in your head and you're just exaggerating everything and your symptoms aren't real and it's in your, no. There's no such thing as in your head and it's not real. There's such a thing as emotional trauma manifesting itself physically, and you need to be self-acknowledging that that's a possibility, and then seek not just chiropractic, but listen to your body and begin to work with people that know what directions to point you in to be able to get the proper imaging, the proper testing, the proper diagnostics, so you can begin to live the life you deserve to live, so you can be as productive as you need to be. And that just is me coming from the heart with my personal experience from the last year and just wanting to pay it all forward. So I'm 15 minutes in now, guys. Please feel free to comment. Please share this video. Like, subscribe, all the stuff YouTube likes. I'm still going to make videos if I feel that this, can help anybody. And I really appreciate everybody that's helped not just the channel grow, but also my patients that come in here and recommend and refer me other people to take care of. It means the world. It means everything to me to be able to give chiropractic and to be able to hopefully help people, be not just pain-free, but certainly manage and help them live, cleaner, better, more natural lives in the world of healthcare. So everybody, have a wonderful new year, and until next time, this is Dr. Pearlman.